To health care for a moment, as the Senate's August recess has already been delayed 2 weeks, efforts to get a health care deal through have been sputtering, with multiple versions of the reform bill now released and GOP senators divided over how they should move forward. So, can the Republicans unite under one solution? To the House side now, and Republican Congressman Tom Reed from the state of New York. He's a member of the House Ways and Means Committee as well. Congressman, good to see you. I'm sure, like all of us, you've been monitoring what the Senate has been up to. Is there a version, maybe what's being put forward by the Republican establishment, that you can support?
Well, we'll have to see what the Senate puts forward.
Yeah.
They have to get on the bill, and then they're going to have to go through their amendment process, and it all depends on what that final bill looks like. But the bottom line is, I hope the Senate acts, because doing nothing is just not acceptable for the American people.
Well, that is one of the questions. We look at some of the key changes that have been put forward in the proposals that are out there. One of the questions is the bigger risk, and I guess this is more of a political question than anything else, to do nothing or to do something that isn't very effective?
Well, I think just the idea of doing nothing. I mean, you got 2 million people today in collapsing insurance markets that are adversely impacted. I just don't think it's politically sustainable, nor the right thing to do for those individuals to do nothing. So they're going to have to do something, and I think Mitch McConnell has even indicated that in some of the public comments I've read.
What about whether you have to repeal all of what Obamacare stood for, taxes and the rest of it, like Rand Paul says? Otherwise, you don't do what you've promised. There are a number of Republicans, especially from the conservative side of the party, say, yeah, we need to do this. Otherwise, you're going against a campaign promise, and the status quo remains in place. What do you say?
Well, you know, I can appreciate the senator's point, but with all due respect, there was never 60 votes in the Senate to get this done in regards to a complete repeal. So we've always been honest with our three-part approach to this: take on what we can repeal in this 51-vote piece of legislation in the Senate, move to the things that Tom Price can do as our Secretary of Health, and then on the third phase, get into those areas that we can reform health care for the American people on a bipartisan basis, hopefully.
You know, there's so much difference within the party now. If you do speak to someone like Senator Paul versus having the conversation I'm having with you right now, it's a very, very different conversation. So, you know, if we're being honest, it's difficult to believe that something will actually get accomplished, that a bill will be passed. I mean, is that being overly pessimistic?
Well, no, I can appreciate that. It's the reality of D.C. right now, and it's very frustrating as a member to be involved in this gridlock. But that's why I try to do my part to look for those solutions that we can come together on, but also try to always advance the ball. That's why I supported the health care bill in the House, send it over to the Senate. This is the legislative process, and I'm really about substance. Now, a lot of people want to just engage in political rhetoric and have the cheap and easy 30-second spin items out there, and that's just not productive at the end of the day, in my opinion.
So you're saying people in your party don't really want to get things done?
I wouldn't classify everybody in the party, and it's on both sides of the aisle. There are members here who are just interested in the political side of it, the political rhetoric, but there's a lot of serious members on both sides of the aisle that want to get things done.
Do you think that carries through to other items, though? What about tax reform? I mean, is that environment going to be the same when we move on to something else? I mean, who's to say just because health care is in the rearview mirror, whether it gets done or not, that all of a sudden we're not having the same conversation regardless of what the topic is, and then nothing gets done there either?
I think we're going to get tax reform done. I know we're going to get tax reform done, because it has to be done, and 2017 is that time frame. Because, you know, talking with our leadership, talking with the American people, talking with the people we represent, everyone agrees the tax code is broken. We need to deliver some relief for the American people, and the tax code is the biggest and most important thing we can do to get this economy going, growing jobs, and that's why it's so critical. It hasn't been done in 30 years, but it will get done.
I hope you're right. Obviously, a lot of people do by the end of the year, as you predict. Congressman Tom Reed, State of New York, thank you, sir.